So I think, most of you are probably familiar with the saying, never act with dogs or children. I'm just going to add a new one to that. Never follow a senator when you're giving a speech. That was really great to hear that message so concisely put together with such a great vision, and that was very exciting for all of us who are involved in healthcare IT. There we go. So my name's Toby Samo. I'm the Chief Medical Officer for Allscripts Corporation, and the panel today is going to talk about improving some of the healthcare issues that are confronting all of us today. We have a particular issue about that healthcare is not just in the doctor's office, it's not just in the hospital, but it extends across that full community of health. And so our panel this morning is going to talk about that entire connected community and how is it that we go ahead and bring all of that information together. Just a little bit about what Allscripts is. We're a healthcare IT company. We run the full gamut of healthcare information technology programs, both on the clinical and the financial side. Our clients, you can see over 180,000 physicians have our products, are in contact with our products, which is more physicians than are members of the AMA. 50,000 physician practices, 7,500 hospitals, and you can see the size of our company. We extend all across the United States in hospitals, physician practices, as well as post-acute care facilities, as well as internationally. So with that as an introduction, I have just a few minutes to go ahead and talk a little bit about that concept of the connected community of health. So healthcare must go ahead and evolve to address all of the changes that that the senator brought forward, financial landscape, as well as the needs of the patient. So my specialty is infectious diseases, and I love to practice medicine, and when I joined Allscripts, one of the deals was that I would continue to be able to do that, so I continue to practice part-time. But through my long-standing interest in computers, I came to understand how the proper implementation and use of computers and healthcare information technology not only improves the health care for an individual patient, but also helps ensure best practices in the treatment of groups of patients, oversees the health of communities, and can improve the well-being of our society as a whole while going ahead and reducing costs. So that's a lot to ask, but I think the gauntlet was just handed down to us to go ahead and move forward with those issues. I think many of you have seen either this slide or something similar to it, that the funding is going up at one rate, but the costs continue to increase at an ever-increasing rate that is significantly higher than what we can go ahead and afford. And this is unsustainable. There have been, the government has actually finally put its money where its mouth is, and there is, depending on how you count it, anywhere from $20 to $30 billion, more than I make in a year, to go ahead and help implement the meaningful use of information technology for patient care. The meaningful use recommendations, it's not a matter of just putting it in, but putting it in and using it in a way that it goes ahead and helps improve patient care and reduce costs. And as we move up within those meaningful use criteria, we see that there are more and more issues that are related towards connectivity implications, because it looks not just at the care of the individual, but over time taking care of the entire community. There are many issues that we as a healthcare community and as an information technology community have to deal with. Never events, readmissions was already mentioned, medication reconciliation, a lot of regulatory compliance that is coming down on us. But whenever there are issues and whenever there's change, there are opportunities. And there is the time for us to grasp at those opportunities, whether it be ACOs, medical homes, incentives to bring those finances in, population health. This is key. I don't think it's getting nearly as much emphasis as it should, because over time, yes, the individual patient is key, but we want to help improve the health care and improve the health, rather, and not just the health care, but the health of the entire community that we work in, as well as in the entire society. So in order to accomplish that, in order to take care of groups of patients, we have to be able to connect. We have to be able to bring in the information that we need and have it available so that it's there when you need it. If you go ahead and look at your bank book, or look at you don't want to know 3 weeks from now what your balance is. You need to know what it is now. And when you're taking care of patients, instant information. So within inside a given entity, we've gotten better at that. But now the next level is connecting to outside, because as you'll see, healthcare is not just this little insulated group of patients or insulated group of caregivers. It extends well outside. This is the current state. Any of you that are involved with technology, would know this, what a nightmare this is to manage it, to be able to go ahead and send information back and forth and hope that there's an interface that will go ahead and bring it forward. This is not a method that we are going to be able to move into the future in order to create that real tremendous flow of information that's needed. Instead, we need to put the patient at the center and ensure that all of the other settings where they are either getting care, and not just care, but coming to get their wellness, ensure that they stay healthy, is connected, whether that's ambulatory, the acute solutions, which is the hospital side, and post-acute, which was nursing homes, skilled nursing facilities, home health care. All of those aspects are things that need to be centered around the patient but have connectivity. And we need to connect beyond the immediate system, and this gives you an idea of, we've got the single patient at the center of that, but we are pulling in lots of information. None of our technological solutions that exist now in this century are built around a single monolith of the mainframes that we had in the past. It is now distributed computing, where you are bringing in information, where you go out and bring it, but it's presented to you in a single manner, where we have a platform that goes ahead and enables all of that information to be brought towards you. So we must move forward with a new vision of healthcare that will reduce costs and also go ahead and deliver the highest quality of care. But this can only be accomplished if we use data-driven analysis to go ahead that extends rather across the full connected community, that leads to improved outcomes. Because ultimately it is about outcomes and about improved care and improved reducing costs, yet going ahead and improving the quality of health care and the quality of our society. So with that, I'd like to go ahead and bring up our first panelist, and everybody's here, the panelists going, who's he going to choose first? And actually, I'd like to introduce initially Ed Frazier from Research in Motion. Many don't know Research in Motion, but I'm sure you all know BlackBerry. Mr. Edward is the Senior Marketing Developer for the Health and Life Sciences at Research in Motion. He's responsible for all the go-to-market activities for BlackBerry within healthcare pharmaceutical industries in North America. And also, just so that you know everybody's bio, is in front of you, so I won't go through all of it, so that we have more time for the presentations and discussions. Thank you.